Hi everyone. Our last part of primary assessment deals with blood-related emergencies. So today we're going to start talking about different kinds of blood emergencies and what kind of care we can give. So the first one that we talk about is hemorrhage. We very briefly talked about this in one of our other videos, but a hemorrhage is an internal bleeding. Okay, usually we get this from being hit, a car accident, some type of direct force, okay? And instead of bleeding on the outside that you can see, this is bleeding on the inside. That makes it a whole lot harder for you to detect. You can see the picture of the eye, all right? And this blood is underneath, on the underneath surface of the eye. If you were to actually touch the eye, your finger would not have blood on it. Okay, so hemorrhage is referring to internal bleeding. Okay, the bad thing about this is if this is going on in our abdomen area, usually this blood is coming from something like one of our organs. So this can result in death. Okay, it's very important to make sure that you realize that this is a life-threatening emergency. This is a call 911, get them to the hospital. Okay, on average, the adult has 6 quarts of blood in our body, which is not a whole lot, okay, it's not a whole lot. And losing only 10% can cause death. And why that is our major organs have to have a constant flow of blood at all times. So if we're losing 10%, our body can't make it up fast enough to compensate for it, and so our organs have to start shutting down because they don't have enough blood, and that can cause death. Okay, our next type of blood-related emergencies is most common, and that's what we call external bleeding. Okay, you have suffered some type of wound, like a laceration or an abrasion, puncture wound, one of those that we talked about in our tissue chapter. Okay, and you've cut deep enough to go through the skin and down to where our actual artery has the blood, and it is coming out of your body. Okay, important things to know about this. If the blood is what we call spurting, okay, which is kind of like boom, 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 okay, if blood is spurting out, then that means you've actually cut the artery, okay? Arteries carry blood away from the heart to the rest of the body, and so it actually beats or spurts in time with your heartbeat, okay? Now, usually these are going to be a little bit deeper cuts, okay? But if you did see that, that would know that you are dealing with an artery instead of a vein. Veins are going to take the blood from the body back up to the heart. Okay, blood that is flowing rapidly but is not spurting is mostly going to be that vein. Okay, so just little things to consider. Okay, when we're dealing with our minor wounds, you know, most of the time we're dealing with what we call capillaries, which is just the itty bitty path that the blood travels in, like our fingers and our toes and that kind of stuff. But the big injuries are when we deal with the arteries, okay? So look for that spurting. How are we going to control bleeding? Okay, this is very important because it's the same steps no matter if you're dealing with a significant blood loss and a very big wound, or if we're dealing with a minor one out on the football field, okay? So we need to make sure we got our steps right. Important to realize that your body does have different cells in your body that help you to clot blood, your blood to clot in the event of an emergency. That's why if you get a nosebleed, even if you didn't do anything, it's going to stop eventually, okay? Or if you cut your finger, the blood's going to stop eventually, okay? There are some people that do not have these blood clotting factors, okay? And that's where we see hemophilia, okay? We'll talk a little bit more about that in class. Another thing to consider is the head, abdomen, thighs, and chest are going to bleed more severely if they are injured, okay? And the reason why that is because we have a lot of important organs there, okay? Our head is going to clearly be fueling our brain. In our abdomen, we've got all of our internal organs, okay? In our thigh, we've got a major artery, okay? So any injury to that area is naturally going to bleed more because there's just more blood in that area on a normal basis, okay? So we have 4 steps to control bleeding, okay? And remember, I said these are the same 4 steps no matter if we're dealing with a paper cut or if we're dealing with a really bad laceration. Okay, the first one is going to be apply direct pressure to the wound. Okay, you can take like a piece of gauze. Okay, this can be your hand or the patient's hand if you have nothing, a shirt sleeve, anything. All right, you're going to take the gauze or the blanket, towel, whatever you have, and you're going to apply direct pressure, okay? It's really important to apply the pressure because it's going to slow the bleeding. And it might not be the most comfortable thing that they've ever done, but you actually need to press down, okay? The second one that you're going to see is elevate the body part, all right? You're going to raise it up the best that you can. Gravity is just going to be your friend here. If you raise it up, the blood flow is naturally going back down, so there's less blood in that area. There's going to be some when to do's and when not to do's that we'll talk about in a second on this, but that is going to be your second step. Apply direct pressure and then elevate the area. The third one's going to be apply a pressure bandage, okay? Again, this is one of those things that it can be a lot of different things. We have gauze that's on a roll, okay? And you're going to wrap the wound, and this is still going to apply pressure, okay? So instead of having to hold to the area, you're going to wrap the area and still have it tight and secured, okay? And the last one is going to be apply pressure to a pressure point, okay? Your blood is everything, every part of your body, the blood's coming from the heart. So we have these different things called pressure points that are going to help decrease the blood flow. So here's our first step. Applying the direct pressure, you can see that they're holding gauze or a towel on them, okay? It's uncomfortable, but they need to apply direct pressure, okay? The victim can do it themselves, okay? Remember, we do worry about contamination. So if you don't have any type of first aid supplies, they can take their own hand and do it because they cannot contaminate themselves. But ideally, you're going to always wear a glove, okay? Knowing where your first aid supplies are located is going to be key here, okay? The second step is elevate the area, okay? So they have their arm, the guy is laying down and his arm is raised up, okay? A big thing to worry about here, though, is you're not going to elevate if you think that there's a fracture, okay? Because if you elevate, that fracture that could just be sitting on top of one another, you could move it, and the fracture site can move and actually cause more damage, okay? So as long as you don't think that there's any type of fracture, you're going to elevate it, and you just need to elevate it 10 to 12 inches or above the heart. Here's another example of our pressure bandage, okay? It can be anything, an ACE wrap, the rolled gauze, anything that you have available, okay? But remember that it's going to continue to apply pressure. That is key, okay? You also want to make sure that you're going distal to proximal. So you can see on the wrap here, they started at the toes and they're pushing the blood up back towards the rest of the body, okay? If we were to do it the other way around, we push all the blood down into the toes and they would have nowhere to go. And the third one is going to be that pressure point, okay? You're going to apply pressure proximal to where the injury occurred. So here's a picture here. If we have an injury on our hand here, the pressure point is going to be right here in the forearm, okay, because the blood's coming from the heart and traveling down the arm. So if we apply the pressure here, there's going to be less blood in that area, okay. Same thing over here in the leg. Let's say if we have a cut on our thigh, or I mean on our calf, all right? If the blood's coming from here and travels down, if we apply the pressure here proximally, it's going to decrease the blood flow. Okay, this is kind of like our last resort. All right, this is kind of where we see tourniquets. All right, those of you guys that have seen that, heard that, this is where that idea comes from. The last part of this is talking about those bloodborne pathogens. Okay, we've already gone over this once. Just remember to protect yourself. Okay, gloves, wearing gloves, making sure that you treat every body fluid like it's contaminated. Okay, you want to be helpful, you want to administer first aid, but you don't want to do it at a cost that's going to hurt you. Okay, just make sure to keep that in mind. All right. People can be untruthful. They can tell you that they don't have any condition, please help me, but that might not always be the case, okay? Especially when we see sometimes in athletics, people hide certain medical conditions, okay? Especially if they think it's going to disqualify them, okay? So please make sure that every fluid you think that you come in contact with, you're going to assume that it is contaminated, okay? It's not worth it. It's not worth it. All right. Remember that you can be contaminated by direct contact. Okay, indirect contact. Remember that bacteria can live outside of the body. Okay, so remember like when we talked about the handrails, sneezing and touching the handrails. Okay, just keeping that in mind. Our precautions that don't share drinks. All right. Don't share anything, makeup, anything, okay? We've already covered that in bloodborne pathogens. And please remember about our diseases that we talked about, the HIV and the hepatitis, okay? Remember that some people may not present with any signs or symptoms. They might not even know that they have a condition, okay? So please keep that in mind, okay? Very important life-changing diseases, and you don't want to accidentally come in contact with that. We do have 5 rules for universal precaution, okay? So 5 things to keep in mind to make sure we're being careful. Always wash your hands, okay? I know we say that all the time, but when you're coming in contact with an athlete or a victim, always wash your hands afterwards, okay? I always think it's funny in the training room if we're taping an ankle and then somebody else walks in and they need like they need a wound covered, but if we don't like stop and wash our hands, then my hands that have touched the athlete's feet is now touching that open wound, okay? It's just kind of common sense, but sometimes it gets forgot. Always use your rubber gloves, okay? Gloves are important, all right? Always have gloves, okay? Making sure that we're cleaning surfaces, all right? Remember our 1 part bleach, 10 parts water solution, all right, that we leave on for 10 minutes. Biohazard. You guys have probably already seen a biohazard container in different places, but if you have soil dressing, like your gauze that's covered in blood or your gloves, we have these special trash cans for them to go into, all right, and that's called biohazard. A special company comes and they are responsible for cleaning this up. So we're going to use any soiled first aid supplies, any needles or syringes that are collected will need to go. And this is what they look like. This is a biohazard bag that we would put our gauze in. And these are what we call a sharps container, okay? They're hard plastic, and that's where we put our syringes, our needles, our scalpels, anything like that, okay? And that's our primary first aid, all right? Let me know if you guys have any questions.